Joining me today is Lisa Skinner, author of Truth, Lies, and Alzheimer's, Its Secret Faces. Through a rich trove of stories culled from her years in the elder care industry, author Lisa Skinner offers insight into the difficult questions families face and debunks the most common myths about Alzheimer's disease and related dementia. Her book provides an unconventional path to peace of mind for caregivers and loved ones facing this devastating diagnosis. She is a behavioral expert in the field of Alzheimer's disease and related dementias. In her 20-year career as a community counselor and regional director of senior care facilities, she has helped thousands of families find the best care options for their loved ones. She holds an administrator's license through the California Department of Social Services. Welcome to the show, Lisa. Nice to have you on.
Oh, thanks for having me, Catherine. It's a great pleasure to be here.
Well, first thing I want to ask you, because this kind of sticks out in it really stands out, I should say, which I read in the intro, is that you have an unconventional path to peace of mind for caregivers and loved ones facing this obviously devastating diagnosis. So, what is the unconventional path for peace of mind for caregivers?
Well, I have certifications in several areas related to Alzheimer's disease and dementia. And one of those certifications is I'm a certified dementia practitioner. And that training included kind of the state-of-the-art therapy that is being practiced today, which is called
Yeah.
it's called the person-centered approach to dementia care. And really what that means is the care and the care planning revolves around each individual person rather than just focusing on the disease, which is the ideology that used to be practiced decades ago. And they found that it just didn't work. So kind of using the term unconventional, the reason why I pegged it that way is because the responses, the best practices that we use now to kind of diffuse situations and symptomologies that come up unexpectedly as a result of this disease is counterintuitive to our knee-jerk or gut reaction to the way we instinctively think we should be responding to some of these. Like,
Okay, let's give some examples. I think, like, you're talking about the fact that previously, if someone was diagnosed with Alzheimer's, you're saying that we just treated all Alzheimer's patients the same, or caregivers did. But now you're saying, look at the person's unique personality, unique needs. There are different ways of caring for someone with Alzheimer's depending on who they are and where they're coming from.
Exactly. So the old way of dealing with people living with dementia, because they very commonly have false beliefs and have hallucinations and, you know, personality swings and mood changes and things like that. These are all part of the disease. And what was practiced before was called reality orientation therapy. And what that means is, so for example, if the person living with dementia all of a sudden claims that their late husband is still living, we call that a false belief. And reality orientation therapy premise was to steer them back into our reality. And what we discovered was that's almost impossible to do, because the person having the false belief really believes that their spouse is still alive and well and waiting for them at home or something like that. And so what we found that reality orientation therapy really did was trigger more frustration and anxiety, and inevitably could lead to basically a meltdown and a shout match that uh, you know the therapist or the caregiver trying to convince that person that their husband is no longer living, and it just turn out to be a huge conflict.
So one of the things
So
that I think is related to that, as I understand it, also it can make the person feel more ashamed, especially someone perhaps is more in the early stages of Alzheimer's, like that, they are embarrassed because they've been told that that's wrong. That's not, whatever you're saying, which may not even, and I want to ask you this, it may not even be an hallucination. It may be just they have things. What do you do when they just have things, let's say in the early stages of Alzheimer's, mixed up? Dates are wrong, or maybe they're confused about a generation. It's not an hallucination. Do you correct them? I mean, or do you let that go? Or because that's different than, like, as you're describing, someone thinks their husband's still alive when they're not. So are there varying degrees of how you should respond, and when you should perhaps correct them?
well, yes, and you are absolutely correct. That is part of the frustration that grew out of trying to steer somebody back into the caregiver's reality. But in the early stages, this is what makes this disease so difficult, is the symptoms, the signs, the behaviors that we see in the earlier stages are very difficult to distinguish between just the normal aging forgetfulness that all of us experience and whether or not it's just full-blown dementia. And the difference is dementia is caused by one of the over 200 brain diseases that we are aware of that cause the very similar symptoms. So Alzheimer's disease is a brain disease, and it attacks the first part of the brain that it attacks is the short-term memory. So we start to see a lot of short-term memory loss. But
Okay,
that
so
doesn't
I guess
necessarily,
that's what I'm talking about. So there is short-term memory. Maybe it just
yeah.
evolves into a little bit more than that, than the aging kind of short-term memory. Is it at that point, do you let things go when people make a mistake, or
Well, they're so subtle in the beginning that most times we don't even notice them until they become so blatantly obvious that there's so many red flags go, oh, there's something a lot more serious going on here than just forgetting where I put my phone or forgetting where I set my keys down. And because of this, most people are not even diagnosed with Alzheimer's disease until they're well into the mid stage of the disease. And there's no conclusive or definitive really diagnosis right now. Um, so it's really a process of elimination for a medical professional to determine what is not causing these symptoms versus, okay, there's a test for Alzheimer's, we're going to give it to you and we'll settle that. It's more of what it's not, and then kind of whittling it down to, okay, we've eliminated everything else that could possibly be causing these symptoms. So, and if nothing else has shown up or been determined, so this is Alzheimer's disease. And that's where we are today. And so the way that it's handled, and I've seen this for so many years with the variety of families that I've helped, is when those signs become so blatantly obvious, then this is the time where you do what we call join their reality and meet them where they are. and not argue with them, not try to correct them. And so many families, they'll look back and go, yeah, you know what? Now that I think about it, there were signs, but they were so subtle that we thought, well, it could just be normal aging forgetfulness. And that's kind of the way this whole entire process plays out with pretty much everybody.
Can we talk about the caregivers? Because in my experience, and as a social worker, I've had a lot of experience with family, friends, and colleagues dealing with uh, loved ones with or patients with Alzheimer's. But in families, the caregiver themselves are expected. There's so much, I guess, expectation that they are going to be the caregivers and that they can handle this. And that I find is one of the most difficult things. I think some of the statistics are that caregivers die before the Alzheimer's patient. They are so stressed out.
That's
Yeah.
a lot of, yes, a lot of them do, unfortunately, and very sadly. And this is true. And we're seeing a trend turning more towards family members becoming the primary caregivers, especially since COVID, when a lot of the buildings where elderly people lived and memory care units where people living with Alzheimer's disease and dementia lived shut down, and it really sped up the decline of the progression of the disease due to isolation and loneliness. And the cost of care has become so prohibitively expensive that we are seeing a new trend of families taking on that primary caregiver responsibility and really not realizing what it is that they're taking on. And just like you said, Catherine, is probably the most difficult disease to care for out of anything, because people have eventually lose all of their cognitive functions. They, not just the short-term memory, but they lose their ability to rationalize things, to use judgment, sound judgment, and sound reasoning in their decision-making process. They lose their ability to walk themselves through simple tasks that
So,
they've been doing.
like, back to my question, how are people, ordinary people, trying to go to work, take care of their families, also take on this, and I'm calling it a burden? What are they supposed to do from a practical point of view? Financial, as you mentioned, is horrendous, and then the impact it has on the rest of the family.
Yeah, it's really become an almost impossible situation, and people are really struggling with, having to work and still maybe having their own kids at home, and bringing in their elderly parents who can't communicate with anybody anymore. This is what I do. This is how I work with families, by teaching them best practices and techniques to really provide the highest quality environment that they can possibly do. But it takes a lot of knowledge and education and skill to be able to do that. And it's knowledge that people don't just automatically have. You have to really know what you're doing to be able to provide a very positive environment for somebody living with dementia.
So, in your experience, and you've had a lot, does this destroy families? How often does it destroy families? Yeah.
Yeah, I've seen the dynamics in families dealing with a loved one or caring for somebody with dementia just split into, completely different camps, and there's a lot of conflicts. I just recently wrote an article on that very subject for a magazine that will be coming out soon on that very topic, the things that I've seen personally, and also based on scientific research and studies of why this typically happens and what families can do about it. So that would be something that would be very valuable to know is the relational things that come up. And a lot of it is due to not agreeing on a lot of different decisions that need to be made. And sometimes that has to do with maybe one of the siblings or one of the family members' hidden agenda. There's just so many factors that play a role into why these conflicts, but there are ways to minimize those conflicts, but you have to really be open-minded to having open and honest communication between each other, and using kind of psychological methods to minimize the conflicts, because I've seen huge conflicts within families.
Yeah. And I think I'm glad your article is coming out, because I think that's really important. I think sometimes the caregivers feel guilty, ashamed, all of those things, in terms of they're not doing enough, or ashamed of their loved one, all of these issues that
Mm-hmm.
you sort of touched on. But I think one of the things, and maybe you can comment on this, is like caregivers have to care for themselves as well. And maybe getting away from it there, or being able to take a break, being able to, at some points, there are respite care or daycare for people with Alzheimer's or dementia. Um, um, one that can be one of the solutions, but there has to be, you can't constantly 24/7 be the caregiver.
And you're absolutely right about that. But unfortunately, what tends to happen is caregivers become so overwhelmed with the tasks involved in caring for somebody with dementia that they put themselves second, which stands to reason, because they're just, every day, every minute of every day, there can be a new challenge that's kind of thrown at them. So they're constantly reacting. And this is just the reality of the situation. So we have to become a lot better at helping caregivers know when to take a pause and step out of the room and, just count to 100 or something. Typically doesn't happen. And that's where the problems really come in, because they always kind of, make the person they're caring for their priority. That's what they're there for, or it's their loved one. And they suffer the most for it.
What about
And I,
when the actually when the person, um, like say early onset of Alzheimer's, let's say someone becomes afflicted when they're 50, not 75. And so they're in a
Mhm.
different demographics. And you've got a 50 or 55-year-old partner, puts them in a very different position. Is this their, so what's your experience with that? Maybe that their sex life is over, their being all of these very intimate kinds of part of their relationship is gone. Do they stay? Do they leave? What happens?
all of the above, yes, you see completely different responses to kind of being thrown into an unexpected situation. Um, Early onset Alzheimer's disease is the rarer type of Alzheimer's disease, and you're absolutely right. It does strike people before the age of 65, whereas our traditional Alzheimer's disease starts to show up starting at the age of 65. So yeah, it creates an entirely different type of dynamic. The youngest person that I just recently heard of who was diagnosed with early onset was only 19 years old. Before that, it was around 30. So we are actually seeing more cases of it, but it's still considered the much rarer type of Alzheimer's disease. So any age before the age of 65, if you start displaying the symptoms of, that accompany Alzheimer's disease, it can be an entirely different situation than if you're an older person. And, maybe your spouse becomes your primary caregiver, but you've been married for 55 or 60 years, and you're in a different place in your life's timeline. But to be diagnosed with Alzheimer's disease in your 30s or your 40s, or even, as you said, your 50s, and you could still be in the prime of your life and in the exciting part of your relationship, your marriage, where you thought, okay, we love to travel, and then those things become so difficult after the disease really progresses to the mid and later stages of the disease.
And the reality is we live so long, which is, I guess, good and bad, maybe. So, you're confronted with the prospect of maybe living with Alzheimer's for the next, 20 or 30 years. There are just lots of, I think, issues that are different now, say, than they were 10, even 10 years ago.
Yes, and to be honest with you, I can't really overstate the importance of having a clearer understanding of exactly what this disease does to people, because most people, in my experience, believe that it exclusively damages our short-term memory and causes us to be confused. And that is not even close to the reality of what this disease does to us. It robs us of pretty much our identity and, our cognitive functionability. So I think that it's really important for people to have a better understanding of what to expect and to be prepared for this to strike their family, because the projections of how many people are going to develop Alzheimer's disease over the next 25 years is expected to triple worldwide. And I really don't think that we're prepared for the amount of people that will be developing Alzheimer's disease. And of course, this is if a cure or treatment is not found within that period of time, but we're not close to that yet. So, the likelihood that this could impact anybody's family has become much higher than 20, 30, 40 years ago.
And I guess this is, we only have a couple minutes left. I guess we're going to leave the interview with we're not prepared. And the problem is going to double, triple, whatever in the next 10 to 20 years. So we better be on top of it and understand what it is, where it comes from, and perhaps come up with some ideas about what we can do. But so it's, and you've presented all of this. I thank you, Lisa, because I think we have more questions than answers. But give us a website and platforms to go to for more information about the book. And you said this article you mentioned earlier in the interview. Where can we find that?
Well, I will post it when it comes out. I will upload it onto my website, so it will be available, but I'll also post it on my Facebook and all of my other platforms. Probably the best place to find out all the information about me is my website, which is mindingdementia.com.
Great. Thanks so much for being on the show today. You did answer a lot of questions, I do have to say.
Well, thanks for having me.
And I appreciate it. Lisa Skinner, she's the author of Truth, Lies, and Alzheimer's, Its Secret Faces. Again, thank you for being